Breaking the cycle to step forward. Authentic conversations from lived experience and a professional perspective in overcoming abuse with Chris Tuck and Beverly Ann.
Hi everyone, and welcome to Breaking the Cycle to Step Forward podcast with myself, Chris Tuck, and
Beverly Ann. Hello everybody.
And our beautiful, lovely guest today is the Dr. Elly Hanson. Welcome, Elly.
Thank you. It is such a privilege and delight to be here with two people who I admire and respect so much. So thank you very much for having me.
Thank you, Elly.
Such a great conversation today. We've got so much to talk about. And I know you said that I might embarrass you, but just looking at your bio, Elly, it just blows me away with your knowledge, your expertise, and we can't wait to get into some of this today and share it with our listeners. So with that aside, let's start at the top. You are a clinical psychologist and researcher focusing in on sexual abuse and reducing its impact. Can you just tell us a little bit about how you got into that and maybe the reason why?
Yeah, absolutely. So, I think it's interesting. As a clinical psychologist, you are trained to focus on mental health. How can we help to reduce mental health problems, and using therapy and other tools to do that. And, as I trained in it and worked in clinical psychology, what I was finding was that behind a lot of mental health difficulties is trauma. And I was working with many people who had suffered sexual abuse and other forms of abuse in their childhood. And so, just, I guess, the kind of empathy and compassion to do something about that, whether that's through therapy, helping people kind of journey on from it, but also, I really then developed a passion to kind of moving a bit more upstream of the problem as well, and thinking and being part of that collective effort that we're all engaged in trying to prevent it.
So the people that you were seeing, the individuals you were seeing throughout your work, were they presenting with a certain set of symptoms or mental health challenges? And did it always go back to trauma from childhood, or was there trauma from childhood abuse, for example, and also mental health conditions?
Yeah, it's a really good question. So for a long time, I worked in a drugs and alcohol service, and the way in which that service was set up and how it ran, and I should say that this was before austerity really kicked in, and then it was rejigged. But we as psychologists, we had the luxury, should I say, of working with people where we could do longer term work than sometimes is available on the NHS, with those people who did have something kind of underlying their drugs and alcohol issue, which was usually trauma, some kind of trauma in childhood, or it may be domestic abuse in adulthood. And so we were able to kind of work with people longer term with group and individual therapy to try and help that. So to answer your question, I have very much seen the impact of abuse manifesting in lots of ways, rather than, like you say, one specific mental health difficulty. It may be, like I say, drugs and alcohol problem, self-harm, PTSD, but also it can manifest in ways that might not be as visible sometimes, such as people being very numb and detached from life and actually not feeling very much at all.
And as we know, that's a big survival skill. And I'm going to say skill because by detaching from our emotions and our feelings, that's how people get through trauma, isn't it? And it's what comes out later on further down the line. And for some people, it could be years. And as we know, 10, 20, 30, 40, or even longer. So that's our body keeping us well. Sorry, Chris, I interrupted you there, so I'm going to pass back to you.
That's fine. But what I was just going to share with you, Bev knows this, but I worked at the Priory Psychiatric Hospital for well over 10 years. first as a business manager doing the accounts, and being senior management level, to help run the hospital on a day-to-day basis, not from a clinical perspective. I'm not claiming that, but I got to understand, when I spoke to the patients just in my normal everyday life, was that they were there for a set of symptoms, but that particular hospital at that time really wasn't interested in knowing or working with the cause. And I found that very frustrating. And it was one of the reasons why I actually left in the end. 2 years before I did leave, after my health impacts came up, I retrained as a fitness instructor, and then I helped implement a fitness therapy within the hospital, and I work with what we call the Gen Psych population. I also work with the eating disorders girls, obviously in a way that was appropriate, and I got to hear their lived experiences, and it was the stories that were coming up time and time again. Childhood trauma, that's all I kept hearing. And then I got to thinking, well, how come they're in hospital with the impact, but I'm not, and I'm working? And that really got me thinking as to why are people impacted in a different way, and what can I do that maybe help others that are not living their life like I was living. Pat on the back, Chris. At the time I was thinking, I was doing all right until I got my impact come up and hit me in the face, so to speak. So that's when I left and wrote the book and started my journey of looking back and working out what was going on for me. So it was really important to actually acknowledge that everybody deals with it so differently, and we've all got a different journey, and there should be no judgment. Back then I did judge because I didn't know any better, but as I've gone on through my life, I don't judge anymore, because we are all so different. And just because you're okay one day or 1 year doesn't mean to say it's not going to catch up with you at another time.
I could not agree more. And I think there's just that, we want to have that openness, don't we, that everybody's different, and that often somebody may appear fine after trauma, and maybe they are, but also with that openness and curiosity that sometimes there is this delayed impact. And linking back to what you were saying, Beverly, that often somebody will be in survival zone for a long time, and actually it hasn't felt safe for their body and mind to start that journey of processing what happened. So there are those kind of dissociative barriers maybe still in place until you're then in a safer time in your life or place in your life to be able to go back to the trauma. And I feel like our bodies and minds are very good at knowing when that time is.
Oh, and that feeling of safe is so underestimated, because safe is different for everybody. And it's safe, in your environment at that time. So that environment doesn't necessarily have to be at home. It can be outside of the home. And this is what sometimes people misunderstand. I feel that sometimes anyway.
Absolutely. And it's, the survivor themselves, their body and mind is going to be the best judge of when it is safe, actually. And this conversation is making me think back to when I worked at the Drugs and Alcohol Service. Myself and a colleague ran a group for survivors of sexual abuse, and we were trying to work out how to evaluate whether the group had helped or not. It was causing some complexity, though, because you've got all of these kind of standard questionnaires, which is measuring maybe somebody's maybe depression or anxiety, but we were thinking about the different emotions that somebody may have following abuse, maybe a lot of anger or a lot of sadness, or not very much of those things. And really the point that we were getting to was that for one person, a positive outcome is that they feel more anger about what happened, whereas for others it will be that they feel less anger. So it's just that really listening to where somebody's at and supporting them on their particular journey.
One thing I was going to pick up on, Elly, is that when I spoke to any individual that was at the hospital for addiction, they were not able to carry on with their therapy if obviously they relapsed. They had to be clean in order to do the program, or, you know, cleaning themselves up, if that's the phrase, detoxing. And if they relapse, they weren't allowed to continue, because and they weren't allowed to speak about their root cause problem, because they were there to deal with the symptoms. And again, that never played right in my mind. I was just thinking, well, until they deal with the cause in some way, shape or form, their default coping mechanism is going to be the same thing. So over the 10, 12 years I was there, I was seeing repeat people come back. They were just on a cycle. They'd go away, they would live their life, oh yeah, I'm clean. But they'd be back within 6 months or a year, because they've relapsed, because they've not dealt with the root cause. And I just couldn't get it.
Completely. I could not agree. I've seen this time and time again myself. And, you know, partly we've got here the medical model at play, the medical model of mental health, which isn't actually, you know, it's just focusing in, like you say, on the symptoms and not asking about the why of those symptoms and looking at the root cause. And what that does is it really works to invalidate people apart from anything else, which actually is what they've experienced as a child in one way, shape or form. And you're then compounding the impact. You know, it's a kind of double whammy, isn't it? That you've suffered this trauma, but you're then suffering a mental health problem, which is kind of badged as just because of you, not because of something that's happened to you.
Yeah.
And like you say there, Chris, we then just are kind of prescribing people to kind of go round this hamster wheel of symptom control without ever going upstream of that. So for me, and like I said, how we worked in that service, yes, you may well need to do quite a bit of stabilization work with somebody, but we really need to have two hands, you know, that you do that stabilization, help them kind of ground and manage those symptoms, but also there is space to process what has happened and to make sense of it in a way that is going to be more adaptive and helpful. You know, and you know what you find is that if people are then able to process the trauma, they're not wanting to use drink and drugs in the same way.
Yeah,
they're learning that wonderful word that I call self-care.
Exactly.
And it's learning it, which is the hardest part.
Yes.
So, Bev, did you want to add anything else to that little bit of conversation there? Because I know that you have been involved in that area yourself.
Yeah, and we could go and talk about this for a long time. I was trying to hold back, but thank you, because I'm very much a believer that unless we enable people to understand what's happening with you know, with their body, how it's responding, but also learn about the wellness tools, not just in crisis, but to help learn. So as it's building up, it's like, oh, okay, I understand what's going on here. What can I do? What have I got available? And that's where I believe it really helps people to then become safe in their own bodies and their own self. And when they're feeling these emotions coming up, okay, I understand what it is. It might not feel nice, but I understand how I'm still safe. I'm here today. I'm not back in that unsafe place. So Elly, we could go on for and Chris, we could go on loads more about that. But it'd be really great to hear. Now you've moved further on, haven't you, now, in what you're doing?
Well, yes, you know, I'm kind of involved in a medley of things, but one strand that the three of us have spoken about and touched on is my work with education, specifically this rather mouthful PSHE education, which let's just stop there and unpack what that is, shall we? None of us.
What does it stand for?
So it's personal, social, health, and economic education. And really, I mean, maybe we could just summarize it as life education. It's that part of curriculum that is, supporting young people with the kind of knowledge and skills to navigate the modern world, really. Well, not just the modern world, also, the age-old world of relationships and health and work.
So
and
we've got a lot.
Yeah.
Sorry, we've got a lot to unpack here, haven't we? Because we've had multiple conversations around all of this, and we're going to talk over each other. I can see it happening. No disrespect to anybody, but before we touch upon all of those different areas, I just want to pick up on the work that you've actually done, because that will feed into what we're going to speak about. So you've wrote a report called Pornography and Human Futures, and it says it's an analysis of online pornography, the nature and business model and harms that follow. You've also been involved with CEOP, producing a preventative education resource, building healthy relationships and creating positive cultures. You've been involved in many academic papers and chapters on online sexual abuse and its impact. So there's a lot of work that you've done, Elly, that's involved children and young people, and the power really of healthy relationships, unhealthy relationships. So what Bev and I really wanted to touch upon is what is actually being taught in our schools at the moment. If you could address that, I don't know if you know, I'm sure you do. And this contentious narrative outside of the educational system, where some adults are saying, I don't want my children having that education. I think there is a miscommunication here about what is being taught and why, and the importance of it.
Absolutely. Yeah, no, and let's get into the thick of this, because it's such an important topic. And like you say, Chris, there are some misconceptions out there, as well as some valid concerns, and I, there's a bit of a culture war going on at the moment around relationships and sex education, which is part of that wider PSHE that we've just mentioned. And I can see the concerns. I wouldn't want to just dismiss them as, people just don't understand. We need to, like you say, start with what actually is being taught, and then kind of journey from there. And I would say to anybody who's got a real interest in this, it is actually worth downloading or having a look online. I've just got it here, which is the statutory guidance from the government for relationships education, relationships and sex education. So that is the curriculum, and that's a 2019 document, which is in the process of being reviewed. I think it's great that it's already being reviewed, because the world is constantly changing, and this really was a kind of first stab, because it only became mandatory then. So this was, in a way, let's start here, and then we see what's working and what needs to evolve. And because there have been questions raised, it is being reviewed, relatively early, actually. My personal view is that this curriculum is a really good start. And for anybody that's concerned about relationships and sex education, I would imagine that much of it would be quite reassuring to read, that there isn't a lot of things that, to my mind, would feel very controversial. There's a real emphasis on teaching children some really core values around trust and kindness and honesty and care, and consent. So, for me, and a real foundation in children understanding friendships and family, before then building on that with that understanding of sexual and intimate relationships.
And that's something that I've got to say is very heartwarming to hear, because we've had conversations on previous podcasts about sex education and what we would like to see within that. And for me, I'm not sure about you, Chris, I won't speak on your behalf, but for me, that's reassuring to hear that that's included in that report. What are your thoughts, Chris?
Yeah, as Bev said before, when we've discussed this, from our perspective being survivors of sexual abuse, if we had had the education around healthy relationships, unhealthy relationships, body autonomy, all of that kind of thing, we feel that we would have been better protected, because maybe we would have had the vocabulary, the knowledge to speak up about what was happening to us. So we just see it, Bev and I, we see it as an important tool to protect children, not for children to take it, you know, they're not responsible for speaking up. We know that. We know it's the adult's responsibility to protect children. But I think there are a lot of children that are being sexually abused that don't actually know that that is what's happening to them. And because they don't know, or they can't voice it or whatever, they aren't able to speak up even if they wanted to. So we just feel that's part of child protection. However, before, I mean, Lawrence Fox, bless him, he's in the news all over the place at the moment this week. But when we've done a podcast before, he was saying that his son came home and said he'd learned that from school, Dad needed consent before Dad kissed him. So I know you've got something to say about that. And Bev and I was like, oh, actually, it's not a bad thing, a child learning about consent. But at the same time, we don't want to take away that innocence and that normal, loving, caring nature side of being human. But it's great that the child is learning about consent. But Lawrence was angry, and he wants to shut down PSHE, whatever the acronym is. He wants to close it down because of that and other things. But I'm just thinking, whoa, we need to just stop here and actually understand why it's needed. Also, our concerns, because obviously sexual abuse affects at least 1 in 4 children and young people at a minimum. No one knows the true prevalence. But it's just like, there's almost like the educational system over here, but it's to get the parents to come on board. We need that extra step to educate the parents as well, so everybody's on the same page and understands why it's all needed.
Completely. Oh, Chris, there's so much in what you've said there that I'm just kind of applauding and resonating with, and just I want to just pick up on a few things, if that's okay. So, you know, the point that you've both made about actually if you had this education, the difference that it might have made, and I feel that very acutely myself. It's one of the reasons why, you know, having worked with the issue of sexual abuse, I did want to move into education. And interestingly, I was involved in a piece of research where we were interviewing young people who'd experienced abuse. Much of that abuse had been online. Much of that abuse had involved other young people. And what, you know, we were talking to them about, like, what would have helped and what are your views on the way forward for society. And what really struck me was that the thing that they most recommended, so the most common thing that they said they wanted, was this good quality relationships and sex education, completely resonating with what you're both saying. And like you say, it's not that we're placing responsibility on children with this, but it feels to me morally wrong to withhold from them an understanding of vocabulary and some skills with which children might be able to reach out for help. You know, and it feels morally wrong to deprive them of that, and that they may be experiencing abuse and then there's just a vacuum around them where we can't talk about sex, and that vacuum, like we know, is being filled with things like porn, which just compound the messages from the abuse rather than provide a rich sexual ethics and vocabulary which could help them. And interestingly, those young people were also saying, you know, it would have helped me recognize what was going on and ask for help. But also those young people who'd been abused by other young people were saying, and it would have helped them. It may have actually taught those young people kind of harming them what sexual abuse is, and may have helped them avoid perpetrating it in the first place.
Yeah, it's bringing an awareness and an education from all different factors, because one of the things we often hear, and I understand it's fear, one of the quotations that I can hear in my mind is, but we don't want to sexualize our young children. Well, sadly, the fact is that there's a lot of young people being abused. Now, that's not a statement to witch hunt. What we're saying is, if we teach about relationships, that I think is fundamental in learning from a young age how to respond to each other within a community. And as we get older, it becomes more natural rather than withholding it. And it's not just about abuse, but the caveat for saying, but it's keeping our children safer and raising awareness, surely has got to be the best outcome, I personally think.
Yeah, Bev, like following on from that, you know, the argument is that some parents or caregivers will say, I want to protect the innocence of my child. So do we all. We want all children's innocence to be protected.
Yeah.
We do. And, you know, I think sometimes the misconception here is that to teach about the principles for healthy and ethical sexual connections versus those that are abusive or unhealthy, the misconception is that that involves a lot of teaching of explicit sex, but it doesn't at all.
No.
You know, actually, this is about teaching principles. So I have a few principles in my head that are my kind of wish list for relationships and sex education. So, you know, I'll launch into a few of them. So one would be mutual enthusiasm, that both people involved in that sexual experience are enthusiastic about it, and that there's a reciprocity. One person's desire is actually playing into the other person's desire in a spiral, rather than someone doing something to somebody else. Another principle would be attunement, so that both people are listening to their own thoughts and feelings and to the thoughts and feelings of the other person, and that is then playing into what happens. There's also the principle of thinking about best interests, my own best interests, but also the other person's best interests, and communication, checking in with each other before, during, and after, honesty and equality. You know, so those are some of the core principles that I would want children to have a very good grasp of. Now, we're just talking about it now. This doesn't involve us going into the explicit details of different sexual acts. You know,
no.
That's not really relevant. So I do think there's a misunderstanding there. And also, I'd very much welcome a conversation with Lawrence Fox about all of
it. I'd be happy for him to come on the podcast. That would be very interesting.
Why not?
Why not? A good conversation comes from all different areas.
It does, doesn't it? But I'm not sure. We should touch him at the moment. What I was going to say, though, is that when you look across social media and in other countries, there are reports from people that report on this, that we are teaching children as young as 4 how to masturbate. And I was like, really? Are we really teaching now children that? Is it really on the curriculum? So I just wanted to check in with you. What have you heard? What do you know about that? Is it true, or is it just...
Yeah, so I am not aware of any concrete examples of 4-year-olds being taught how to masturbate. I should start with that. I think, you know, what they're tapping into is a concern that there are some materials out there that are sexualizing children or introducing sexual knowledge at a developmentally inappropriate time.
Yeah.
I hear that concern. I think there are some problematic materials out there. So like I said, I don't completely dismiss it. What I would be in favor, I think the curriculum itself is not suggesting anything of the sort, you know, but that's not to stop people devising materials like that and some schools to be implementing them. I think there is a journey to really kind of evaluate what schools are doing and to offer teachers more training. So I do a lot of work with the PSHE Association, which is a membership body for teachers and schools, and it really has that aim of kind of training and teaching kind of good principles for this education. So that's one particular body that would support a kind of sensible approach to this. I'm not saying it's the only one, but you know, I think that there is a journey there with teachers being trained in this to a more thorough and deeper level. You know, it's relatively early that this has become a mandatory subject. It's not taught in, you know, if you're a history teacher, you're taught to teach history, but no one in their teaching degree is taught to teach PSHE. And I think that's a real gap, because it's potentially one of the most complex subjects. So for me, that's the direction of travel now. And I think, you know, asking schools to do a bit of an evaluation to make sure that all of their teaching materials is in line with the curriculum. And, you know, they're hearing these concerns and that they're checking things.
And, you know, the sex education needs to be age appropriate. We've always said that. So as children become young people and young people hit, you know, puberty, then there will be, obviously, as nature's intended, there will be some exploration going on. And there's nothing wrong with that. As a survivor, I have my own personal issues all around that, and we've spoken about that before. But in a normal, natural environment and growing up, then self-exploration will happen. Should schools be responsible for teaching that age appropriately? I don't know. I just don't know. It's a bit. I'm a bit uncomfortable with all of that, but that's a personal thing. But if they don't learn it from a valid source, as in all areas are talked about age appropriately, then they will turn to porn online. So can you talk a little bit more about your work with all of that, and why you feel, or why we know that it is an issue with our young people now, because they think that porn is relationships, and it just isn't, especially if it is not conducive to being healthy and appropriate.
Yes, I mean, I think it's a massive issue that is really kind of affecting a climate change across our society in terms of relationships and sex. But, you know, people are uncomfortable kind of going there a lot of the time. So, you know, one of the things that I feel is that porn is both everywhere and nowhere. You know, it's having so many people are watching it, and it's distorting things. But there aren't as many of these kind of conversations as there should be about, you know, what is going on here with this huge cultural change. And, you know, when we look at pornography, again, people might have a kind of misconception that, oh, we're just talking about sex and nudity. Well, no, we're not. The porn industry is pushing certain sexual scripts that fundamentally make it money. So if we think about, you know, the human mind, we have a potential, that there's such rich potential. Our sexuality has a multitude of potentials. You know, people can be turned on by a variety of things. You know, but which doors in our mind do we want to go through? And some of those doors of our sexuality are healthier to go through than others. And fundamentally, sexual scripts, a sexuality that is based around trust and it being personal, you know, that actually that sexuality is because of this attraction with this other person, and there's a chemistry there. Now, that might be in a long-term committed relationship, it might be in something very short-term or a one-night stand, but fundamentally there is that connection between two people, and I would say that's really key to healthy sexuality. Now, porn can't make money from that connection between two people. It can't get into that space, and if it does, then something's fundamentally changed, isn't it, once you kind of monetize that space. So it kind of sidelines relational chemistry-based sexuality. It dismisses it. I mean, I've even got many examples of it actually sneering at that kind of sexuality and denigrating it. And in its place, it pushes these impersonal sexual scripts. So, you know, sex is about just following your arousal wherever it leads, that's sexual freedom, and you know, sex is about dominance and transgression, or you know, manipulation and persuasion, and it's, you know, very laden with gender norms that women like violence and want to please men, and men should be in control and, you know, be dominant. So it's pushing these messages about sex, which, yes, whilst people may get turned on by them, that doesn't actually encompass their sexuality, and pulls them away from this richer, ethical, relational based sexuality.
That's one of the challenges that I find as well, because we're talking about education within school for younger people. But one of the conversations we've had is the education they have when they're watching TV. You know, even before the watershed, we see adverts for different programs that are happening. We see videos. I mean, I'm not saying that I don't enjoy watching some of the dance videos, but when you look at them over the years, and it's not just now, they've been happening for a long time, some of the acts that are portrayed within those videos are pornography. When you look at the pornographic messaging that's coming through, as you've just said, our children of all different ages have access to that. And that's where the messaging is being time and time again processed to them. And yet when we want to change that, people have a fear. So on one side, we have people saying, don't teach children sex to our children, you're taking away their innocence. And yet in another factor, such as our television, we are portraying these sexual messages all the time.
I think you've just completely summed it up there. And, you know, between those two positions, children fall with nothing to help them navigate this increasingly complex world where you have big corporations seeking to shape them and their sexuality towards profit. You know, and actually that's a real scandal. And, you know, I think what we here are advocating is a third way where children are protected from that kind of content, as well as given a framework of healthy sexuality, like, you know, you were saying earlier, a vocabulary, and an understanding of the kind of sexual experience that we can say is good and healthy, which will help them then also spot those forms of sexuality, those sexual scripts that may pull away from that.
I think it's also really important just to address the word pornography as the word, because Bev and I have spoken about this before, Ellie, and to us, pornography means consensual sex, acts of sex with two consenting adults. So some people that do work in the sex industry, they may not be consenting. So I just want to add that in there. But usually porn is thought about as adult footage between consenting adults. So when they come along and say child porn, it literally grates on us, because that in itself often makes it seem like it's consensual, where porn and child should not be in the same phrase. It just shouldn't.
Yes, and I yeah, absolutely. And I mean, for me, if I have to say, my own personal experience of the phrase child pornography is actually a real, for me, it works to say that's abhorrent. You know, I'm not saying that it's, I totally hear you about it's not an appropriate phrase, but there's a kind of grappling around language with this, isn't there? Because we've now got the phrase child sexual abuse material, which replaces child pornography, and that's then shortened to another acronym, which is CSAM. Now, my slight issue with that is that it kind of puts the horror of this behind an acronym.
It softens it, doesn't it?
It does. And in a way, should we be saying images of child rape?
Yes.
You know, actually, let's bring the focus back to the, you know, fact we're talking about something that is really abhorrent here.
Yeah.
And ensuring that people do feel the emotion of this, rather than
Yes.
these acronyms that can kind of sanitize the whole thing.
Yeah.
Yes.
So that phrase, child pornography, for some it's abhorrent, but for others, because they just hear the word pornography, they, oh, so child pornography is acceptable, is it? That's how some people's minds work. So it's just like, no, it's not acceptable. But I get where you're coming from. I never thought about it before, about CSAM and it all being softened down.
It's a tricky one, isn't it? And maybe, you know, I'm not saying we get rid of the term CSAM, but we might just need to do a bit of unpacking of it when we talk about it, so that we always keep the heart of what we're doing, aren't we? And you know, and the horror, the horror of what children are going through, and that we want to protect them from.
And this often, I feel, gets missed, because there's one side that says, and I understand this, I'm not denigrating anybody, but we're looking at it from all aspects. There's one side that says we don't want to sexualize our young children. But then, as Chris said earlier, 1 in 4 that we know of, young people, and we know that it's as young as, well, I don't mind sharing, I was just about 4 when my abuse started, and I'm not the only one. I'm one of masses. You know, sexual abuse starts from a very young age, including babies and toddlers. So if we don't find a way to open this language, what the silence does, and that's what it is, silence it, it becomes a norm. And when it becomes a norm and that it's not talked about, that means it will continue.
Going back to language as well. So I was intrigued why some people call it sexual violence. Why do some people call it sexual abuse? Why do some people call it rape and sexual assault? And what does sexual assault mean? So we've got this language that it you know, we all think we know what it means, but it means different things to different people. So especially globally, when you look at globally, they call it like sexual violence, but not all abuse is violent. There is a lot of misplaced, can you see me get my back going up here? Misplaced sexual misconduct going on, sexual abuse going on, but it's not always violent. And this is where many victim and survivors have issues or challenges dealing with their impact, because he loved me. Yes. I love him, especially if it's like family, dad or granddad. But yeah, I understand that what he did to me wasn't right, but he loves me and I love him. So there's a lot of stuff. It's so complicated.
It is complex. And I think maybe what we're saying is that we kind of need all of these words, and we need to use them in an expansive way, so that nobody feels excluded by the language. Because like you say, you know, many people are not going to relate to that word violence. So if they only hear the phrase sexual violence, then there's the risk of thinking, well, then I'm not a survivor of this. And I've recently been doing a real focus of my work recently has been around sibling sexual abuse. And what we find is many survivors of that, they feel like they don't belong in the world of survivors. You know, well, actually, it maybe it was consensual, or you know, it doesn't fit maybe the stereotype of adult to child, or maybe it started off as something that was an experimental sexual play, and then it changed as time went on. And so that makes it harder for them to recognize that no, it was still abuse. And you know, you can validate the impact that it has had and go on a journey from that.
Absolutely.
Going back to what you just said, Elly, we've touched upon this before as well. There are incidences where young children particularly will just be playing and exploring. How do we as a society or professionals, how do we separate an incident of play innocent play and exploration to something that may develop more into some kind of sibling sexual abuse? What are the parameters around this?
It's a brilliant question, and it is a question that has plagued the kind of researchers in this field, I have to say. And I've just read umpteen papers that say, oh, we don't have a definition of sibling sexual abuse, because where do we draw the line? I actually think that, we can draw the line. And we know we do need to be doing more research on what is kind of normative, age appropriate sexual play, and we know that does occur in children across the age range, and we do not want to stigmatize or shame that at all. But I think for us to be then noticing that it's actually something that's problematic or abusive, there are certain things that we can be looking out for. So, for example, is it kind of compulsive? Is the child engaging in it even when somebody's kind of diverted them or given them a boundary there? Now, again, that might not mean that they're abusing anybody, but it might suggest that there's an issue there for that child that they need some more support around. If we're then looking at abuse, we need to be thinking about, is there any kind of power differential between those two children? Is there any kind of coercion? And also, how mutual is this? Is this one-sided or not? And so I think if you kind of go through a bit of a checklist of these different indices, you can quite effectively differentiate something that's at one end abusive, then moving down a peg, problematic or inappropriate, but not necessarily abusive, and then the line between that and actually something that's quite normative that we really don't want to clamp down on, because that then just shames something that's perfectly okay.
And that's where
isn't it? Let's not talk about, Bev.
And that's where I think, coming right back to the beginning, when we are talking about relationships, about consent, understanding, I think that in that area really shapes it, really defines it. Because the other thing that I think is important for, particularly our listeners to hear about, that something can start being consenting, but that doesn't mean to say it's set in stone. Exactly. And it can change. It could be, actually, no, thank you, but no, my consent has changed for whatever reason.
Exactly. And maybe sometimes a child is experiencing something, like you say, that may have been between, two children. It felt mutual at one point, and then actually they don't want it, but they don't know how to say that or express it. And so they can even feel that they are consenting. And so then that really plays into the kind of self-blame and confusion about what happened, which is why I am keen that when we teach about sexual abuse and healthy sexual relationships, yes, we do include consent, but that isn't the be-all and end-all. Because many people experience things that they feel they've consented to, but actually there was a lack of mutuality. And those principles that I was talking about earlier, equality, attention to each other's best interests, all of those things, some of those ingredients were missing.
So we're talking about children here, young people that understand what we're talking about. We're not talking about youngsters and all of that, because they're going to have no grasp on any of this. They're not going to be able to think about any of this logically. So it needs to be, as we said, all the way through, age appropriate.
I agree. I think a kind of spiral curriculum, and the three of us have in the past talked about the pants rule, for example, from the NSPCC, which is a really nice starting point, teaching young children just some really clear things that they can expect in, from the people around them in terms of respect and boundaries. And I think that's a beautiful place to begin, which can then be built on as children grow older and they can take in more information about this.
And I'm glad you said that, Ellie. Sorry, I jumped in there. Because for me, when we talk about certain areas, one of the things I personally have found challenging, and it does come from my own experience, is the fact that sometimes the the abuse can happen outside of certain areas, because there's things that, you know, as a child, young person, you're being asked to do. So that's where, as you said, expand on it as we go along, which is good to hear. I'm also going to be the bearer of bad news. We've got another 10 minutes. So we need to be aware of that, because for anyone listening, you know that I'm the one who's watching the time. And we could really carry on, because Elly, you've done quite a bit of work with the NSPCC yourself, haven't you?
I have. So yeah, that actually is the sibling sexual abuse work that I've been doing recently is to inform their work on this issue. But yes, in the past I've done various other things with them, including working with young people with harmful sexual behaviour as part of in one of their teams.
I want to pick up on some of the points that you guys have just said. Now, going back to potentially sibling sexual abuse or same age abuse incidents, let's call it that. Some professionals, if they see that or hear about it, they will go, oh, it's just tomfoolery, it's just playing around, where in fact the impact can be catastrophic on one of those people within that incident. Or on the other hand, it's like, oh my goodness, this has happened, we've got to separate them, we've got to do this. So it seems to be extremes. There doesn't seem to be, from where I'm sitting, an actual sort of pragmatic and common sense point of view being taken from the professionals that I hear and see what's going on. Have you got anything to say about any of that, Elly?
Well, I completely agree with you, and your perception is very much backed up by a lot of the kind of research on this, that there can be those two professional responses. And you know, that's why we've been kind of doing this work, really, that there is an increased focus on helping professionals, like you say, kind of take that third way, where it's not minimizing it, but it's also not catastrophizing it. It is that assessment based. Let's actually stop and think what has gone on, really listening to both children or however many children are involved, and you know, not forcing a certain narrative on these children or family until we kind of know more, and they can develop their own, you know, their own language and understanding of what's happened. So in these kind of situations, what I would really be advocating for is that both children do have some therapeutic support, which may be quite different in focus. You know, if this is behaviour from one child to another, then the child who has harmed will need some work around that, versus work that's more trauma focused for the other child. But I would also be advocating that support for parents, and possibly also for other siblings as well, because you know, if sexual abuse happens within a family, then everybody's affected, and often the other children and their needs are kind of missed, actually. And so yeah, kind of really advocating a whole family approach that is thinking about safety, it's thinking about healing, and it's also thinking about justice, you know. And I mean, that's a big word, you know, but I think, as we know, the criminal justice system, you know, rarely delivers justice. But are there other ways that we can think about justice in these very complex family situations? And I'm really keen to have those conversations.
I think also from the work and what we heard through the independent inquiry into child sexual abuse, when sexual abuse took place within institutions, I remember one survivor shared on many occasions that there was a culture of just allowing the sexual abuse to happen. So it was almost like a rite of passage for the older boys in these institutions to sexually abuse the younger boys, and it was just accepted and it was normalized. Yet that boy who spoke up as a man said it was just the most horrendous thing that the impact of it is just turned his life upside down. And because of the word, well, it's just boys being boys and it's tomfoolery and it's just exploration, it actually devastated his life. And I think that we just need to know that there's these two extremes being played out, but we've got to really, as you said over and over again, you've got to look at it from whoever's involved and give the appropriate support where it is needed. But where there is a pure act of crime, that also has to be dealt with in the right way as well. And it's holding those people to account that are running these kinds of institutions, that have allowed this culture to manifest and carry on, because it's not right.
It's not right at all. And as we are coming to the last 5 minutes and thinking about to wrap this up, I know I'm looking at you, Chris, making your faces. Elly, I'd like you to think, and I am putting you on the spot here. You know, I've got a couple of minutes to sort of bring this to an end. And how do people, after listening to this, what would you advocate for them is their next step when approaching the schools, when they ask them about, you know, PHCE, what's going on in the lessons, etc. What would you recommend to anybody listening to this podcast today?
Well, I think you've kind of said it in your question, which is having that conversation. I think that's brilliant. You know, and it links into what you were saying as well, Chris, that there needs to be that two-way conversation between schools and parents. You know, it is completely fair enough if parents have questions and maybe have concerns, and I would just really encourage that dialogue. Schools then should be providing parents with a good outline of how they are meeting this curriculum that we've spoken about. You know, what materials are they using, and also the question is, you know, how can parents support this, because this is not work that schools can do alone. So I would suggest that schools are supporting parents as well in reinforcing this education back at home.
One of the issues we always highlight, though, Elly, is the fact that if abuse is taking place at home, those parents will not want their children having this education, because obviously they won't be able to carry on doing their abuse, sexually abusing their children. So this is why it's so important for us to know that this education does exist within the educational setting. So it is out of the hands or in the power, not in the power of the parents who could potentially be abusing their children. And that's why I think that's so important. Yeah.
And it's why this education, it needs to be statutory. You know, every child has a right to it. Obviously, we're not talking about education that is inappropriately sexualizing children, but we're talking about this kind of clear education on these principles. Yeah, I come back to the words of Gail Dines, who does a lot of work in America around pornography, who just summed it up for me when she said, you know, children have the right to author a sexuality that is rooted in intimacy, respect, and connection. You know, I fundamentally believe in that right, and that is a huge motivator behind the work that I do.
Yeah. And thank you. And I just want to say, and it's something we discussed before, but for anyone listening, I just want to share that, Elly, you're not actually a survivor of sexual abuse. And we think that that's fantastic, because there's many a person who's not a survivor. They're a supporter, ally, and they're always saying, what can I do? And I think what you really shine through is you're an advocate of that you don't have to be a survivor to want to keep children safe. You know, it's about having that passion. And if anybody here is listening who's not a survivor and they are looking for someone to inspire them, I think you're an amazing inspirational person, and I thank you for all the work that you do.
So that's kind, and I thank you both, and I really resonate with that this is, you know, the work to tackle abuse is a huge collective effort. It needs us all, doesn't it? And surely we all want to live in a world where children are free from abuse of all kinds. And yeah, we all need to get involved in that effort, whoever we are, whatever experiences that we've had. And yeah, we're kind of saying, aren't we, everyone's welcome to join this. And
absolutely, absolutely. Chris, any last thoughts for today?
Well, I've got so many questions that I want to ask. So, Elly, if you really fancy coming back onto the podcast in the future, please will you join us?
I would love to. It has been such a pleasure today. Lots that we've explored and lots that we can further explore. So yes, I guess we're kind of saying to be continued.
Exactly.
Absolutely.
Yeah. Beverly, what about yourself?
Well, just to say that we will be putting any links that we've discussed and Elly shared underneath. If anybody has any questions, can they email Breaking the Cycle to stepforward@gmail.com, and that link will also be underneath. For me, I love conversations like this because, you know, anybody listening in can take something away, and, you know, it will either be something that inspires them for their own recovery or something that gives them knowledge, and hopefully the next person that opens up to them, they'll be able to sit there and say, oh, actually, I'm listening to you and I hear you. So yes, thank you for today, both of you, and that's it. It's time to say goodbye.
Bye, everyone.
Bye-bye, everybody.
Bye. Thank you.